And welcome to another edition of Inside Town Hall. I'm Jim Cameron, your host and the program director of Darien TV 79. And you, as a faithful viewer, knows that Inside Town Hall is a program where we interview the folks who help make Darien town government work and work really well. Our guest today on the program, David Knauf, who is the he's outgoing, but he's soon to leave as director of the Darien Health Department. David, it's good to have you back on the show.
Thanks, Jim. It's good to be here. Thanks for
You
the
are
invitation.
our most frequent guest. Over the years, you have graced our airwaves more than any other individual, which I guess speaks to the importance of your job. But you are leaving, I believe, July 1st of this year.
Yeah, June 30th is officially my last day. I wanted to bring it right to the end of the fiscal year. So I have a little count going. And as of today, at the end of the day, I have 20 working days left. And I
And
have a lot
what?
to do in that 20 days.
Oh,
There's a
yeah,
lot that I want to get done.
we'll cover that. Why are you leaving and what are your plans?
Well, why am I leaving? It's certainly not because I'm bored. This job it's just been amazing. The scope of issues that we're involved in, it's every day isn't something new comes up every day. So it's been kind of fun. The thing is that, I've just reached the point in my life, age-wise, that I feel as though I need to spend time more focused on the time that I have left on this earth while I still feel well. So it's really, I guess, a selfish move, in large part, because I do like my job. I'm not leaving because I don't like it here, and I'm not leaving because I don't like what I do. I do like what I do. As I said, there's not a day that doesn't go by without something interesting, multiple things that come up during the course of our day.
Well, I think you're making a wise move to be able to go out and enjoy life. You've certainly earned it. You have been health director for almost 15 years now. Uh, where did you come from? What's your background, and how did you come to Darien?
Yeah, it was 15 years in September. Um, Prior to here, I was assistant health director in the Farmington Valley, northern part of Connecticut, which is where I spent a better part of my career and life, living and working in the Farmington Valley. I was. It's funny, recently I was in a dentist's office, and there was a sign in front of me that congratulated the dental hygienist on 50 years at being a dental hygienist. So as I'm sitting there, I'm thinking about it, and I did the math, and I realized my first job in public health after I graduated college was in 1974 for the State Department of Public Health. And then I did that subdivision, subtraction. It's 50 years. So 50 years ago, in the fall of this year, of 50 years ago, I had my first job in public health. So it's been a long career, and I've been blessed, working for the state, working for local health in a district, and working here for the municipality. I've seen all of the spectrum of public health in Connecticut. It's been a great experience. And how I got here was I sent in a resume, did an interview, and was fortunate enough to get hired. Now I was living in northern Connecticut at the time and had no idea how I was going to make this transition. But it was a big one. I sold my house and moved down to the coast, and which is what I really wanted to do at that time in my life, and it just worked out. And so living by the coast, working here by the coast, it's been great.
And were you not the town's first full-time health director?
I was. I have been, yes. Prior to my being here, there was a series of part-time health directors. So yes, I'm the first full-time director. here in Darien.
And what has changed in terms of the responsibilities of the health department or people's interest in health generally over those 15 years that you've been working in Darien?
Well, we we have a whole new food code that we're working with. Um, so it's changed how we basically do our food inspections. And the other thing that's happening, as everybody can see in town, there's an awful lot of new commercial development occurring. And that is putting a lot of pressure on not just our department, but the town in general with respect to doing, the inspections of these facilities and, just keeping up with the pace of development in town. That's a big thing for us right now. But we have those mandated responsibilities that we're charged to do. And interestingly enough, even though they're state mandated activities, we do not receive, the health department here does not receive any state funding because we don't have the minimum required population base that would enable us to get state funding for this health department. So the town is basically paying the way to fund our health department. We've done, I think, a great job. We're efficient. We have a great staff. I've been lucky there too. For the years that I've been here, the people that have worked for the department have been excellent, and we've had, generally speaking, I'd say a great working relationship with the administration in town, supportive, through most of our endeavors. And of course, we did go through the pandemic. That was something
We'll get to
was,
that. I promise we're going to get to that.
yeah,
But
that was something different, and we all learned from that. One of the things we learned is how to do what we're doing right now, the video conferencing. That was not something that we did much of prior to pandemic. So that's a positive outcome. So,
well, how big is your department now? What's the staffing like? What's the budget that has just been approved by RTM and the town?
we have, beside myself, full-time health director, we have two full-time sanitarians. One of those two sanitarians is a recent addition, and that was brought about after lobbying for the past couple of years to basically meet the needs of the new development in town. And
And what is a sanitarian?
sanitarian really is an inspector. We do plan reviews. It's really our department is primarily focused on environmental health, which means that we spend a lot of time doing food service inspections. Believe it or not, a lot of Darien still relies on septic systems for wastewater disposal from households. Probably about 25% of the town still has septics and will for the foreseeable future still remain on septic systems. And that's a time-consuming and complex situation here because, as we know, homes are big. There's soil conditions are kind of tough, so it's very time-consuming work. We get involved with well water. We've had when we had the smoke situation last year, we're doing outreach to the public and to town administrators, trying to advise on the impacts of that. We do beach water sampling. We inspect cosmetology salons, public pools. So there's a lot of that component of our job that we do. We also track communicable diseases, and we're in the process right now of finishing up with. That's another one of my goals to finish by the time I leave, which is getting close. Our community health needs assessment update. So, what are the demands? What do we need in town? Where are the, health issues that we need to address? We have a draft of that I've received, and we're in the process of reviewing that.
David Knauf is our guest today on Inside Town Hall. He is still for a little while, the director of the Darien Health Department. So yeah, you took my next question away. The community health needs assessment. What is that? And you've got a draft. Can you give us a hint at what the findings have been?
Yes, we have a draft. It is
There it is.
there it is. So,
So why do you do that? What's involved with doing that assessment?
well, we started off by doing a survey of residents. What do you perceive issues in town? How do you feel about living in Darien? How's your health? What do you think are issues that the town does well? What don't we do well? How do we address your health needs? And we made it available across the community. According to our consultants, they felt that a return of about 500 or so was statistically significant. We received over 700 returns on that from residents in town. And there were some surprises in it. We listed all, what are you most concerned about? And categories of things that people were worried about. And one of the things that was repeatedly mentioned was bullying in schools. And that was something that I'm not sure that we expected to find. We found that the type, we also did demographics, research. We also found that the last time we did it was in 2017. And in 2017, most people were commuting multiple hours a day to get to their places of employment. Today, most of the respondents and the survey indicated that people are working from home. So there's a big change in what's happened with the way people work here in town. I think that we also found that something that we have known, and that is there's a tremendous level of volunteerism in the community. People are really interested, who live here generally are more interested in what goes on in this community than typical communities throughout Connecticut, and certainly that was borne out through our experience during the pandemic with the level of volunteerism we had and support from the community when we were running those clinics. So, and the other important thing that we found is in general, we do not have a problem accessing healthcare here in town. People feel that they're healthy, and mental health is a concern, but the respondents in the survey didn't indicate that there was a high percentage of concern over that. But again, these are preliminaries. I haven't had a chance to go over this draft yet. I want to take a close look at what our chronic diseases are and causes of death, cancer rates and things like that. I haven't had a chance to look at. That's going to be something that we'll be doing over the next couple of weeks.
So what's the timeline on the issuing of the final report? Who does it go to, and what kind of actions are you thinking you're going to call upon them to take?
Well, this report is several months behind schedule. It was supposed to be done in January, and due to circumstances beyond our control, it's just been delayed. I'm really hoping that at least we have the report completed by the time I finish up here at the end of June, and that we can accept it. And at that point, we turn it over to the basically the town board of selectmen and whoever's my successor. And the intent of doing the health needs assessment is to then move forward with a community health improvement plan, taking what has been identified as issues in the assessment and moving forward to, do whatever actions need to be done to address whatever deficiencies have been identified.
So it sounds if you said that school bullying is an issue, That's going to be an issue that the Board of Education is going to have to address.
Right. And, along those lines, another thing that we're involved in, which is very timely, is that we're looking to support the community fund, work with the community fund and schools to establish a teen talk mental health counseling program at the middle school. So we're looking to, be help fund that position with the community fund, and soon there will be an announcement about this going public, looking for community input to get some donations to help develop this program, because community funds putting in some funding, will be putting in some funding, the health department representing the town, because we believe that this is an important piece of mental health, addressing mental health, and maybe get at some of the causes of concerns with respect to bullying.
There you go, ladies and gentlemen. You heard it here first on TV 79, breaking news, as they would say. David Knauf, our guest, he's the director of the Darien Health Department. Mental health. We heard a lot about this during COVID, and I think some people are scratching their heads. What's wrong with kids these days? Is it just kids that are suffering from mental health issues? How does it manifest itself? How do I know if I or my child is having a mental health issue? What's the background to all this?
Well, the background. I think that we have always, and I think there's always been a concern here in this community about the impact of stress and the need for constant achievement and achievement at a high level. So it's just constant pressure, and it's the concern, how is that constant pressure going to impact, me, my health, with respect to things like even substance misuse. So there's many ways that pressure and stress can manifest itself. And it's really, I think that what we need to have is a self-awareness component of stress levels and managing stress. I don't think that, in general, one of the things that our survey did find was that people are finding outlets and they are taking time for themselves, at least through our survey. But we also recognize, and the fact that working from home, while it may be convenient and you take out the commute, it also blurs the line between personal time and work time. And as you know, I'm a commuter, and I spend a fair amount of time in my commute, but I enjoy that in large degree because I do have that downtime while I'm in between here and home, when I'm not necessarily working on an assignment of one kind or another. So, trying to have a balance in life, I think, is key. And, talking to your kids. Kids don't always want to talk to their parents, and they don't necessarily want to talk to anyone in a quote position of authority, which is, again, one of the reasons why we think this Teen Talk program would really benefit the community, and why I for one, am really in support of that, moving forward with that.
But this issue of stress on kids and bullying in the schools, doesn't a lot of this go back to the parents? I mean, where is that stress coming from? Is it not coming from pressure of the parents? You got to succeed. You got to get into Harvard, Yale, Princeton, whichever it is. And that's also demonstrated in the school system. If the pressure comes from parents to the school system, you got to have more advanced placement classes, et cetera, et cetera. Aren't the parents to blame for a lot of this?
I'm a parent, and I have expectations of my child, and I think that's not so unusual for parents to have. So where's the balance? And it's hard to say. I certainly can't blame parents for wanting them to have their kids be the best that they can be. That's what we all want as parents. So I think I think it's not the parents' fault necessarily for kids bullying, but I think if issues are brought to parents' attention that kids are involved in that kind of stuff, then I think the parents need to address that issue with their children directly. If your kid has been identified as being problematic, well, let's face that issue and deal with it as a parent.
One of the ways that adults deal with stress is by drinking or using now legal marijuana. Did anything show up in your survey about either one of those? Is the legalization of marijuana having a strong effect on our community yet that you could ascertain in your study?
We had, as part of the survey, we did ask about people's consumption of alcohol. And when we initially developed the survey did not include "I do not drink" as being one of the answers. I don't know what that says about those of us who created the survey, but it didn't say "I don't drink." And we actually received written complaints about not having that category in the survey. So, I mean, and we did not see that in that it's a blind survey, so people could be honest and not worry about it being traced back to any individual. We didn't see that much of an issue.
You mean drinking in general?
Yeah, not in our survey. We also, it's interesting because we do get the reports from our post 53 and the EMS for their calls, and we do not see, and this was something that was identified as a concern in our 2017 assessment. We do not see that there's a large overdose or drug problem in town. I am personally and professionally very concerned about legalization from the standpoint of edibles in particular, because, especially if it's available to kids, because it takes a while for an edible THC product to be felt. And so if somebody ingests a gummy or a piece of chocolate and they don't feel anything for the first 20 minutes or so, they may be inclined to have another one and maybe a couple more. So I really worry about the impact of legalization, especially where it pertains to the edibles. And there's no way really to control that unless the parents are really paying attention to, if they're using, to make sure that their kids can't have access to it. I realize how difficult that might be, but it really is important because I think that we're going to have, I wouldn't be surprised if down the road we don't have problems with the edibles in particular. You usually smoke, and you're done, because you feel the effects fairly quickly, but the edibles you don't.
But you
So
have
that's
not heard from Post 53 that that's a problem yet.
not yet.
And you're right. I mean, if adults go to a marijuana cannabis dispensary and get edibles, it's their responsibility to keep them safe, the same way they should lock up a gun if they have one in their house too, because they don't
Absolutely.
want edibles look like candies. I'm
And if you're
I'm
sitting
told.
around the table and you're having dessert, it's acceptable to have a martini or a glass of wine, so the other part of it is that, it's like the normalization of smoking pot or smoking marijuana and, sitting at the table and kids are there, at Thanksgiving or whatnot, and, having a bowl of chocolates or gummies, I don't know, I never was a supporter of the legalization, except for that part where it said, if you could go to a place to buy something that you knew was safe, if you're going to use, then the dispensary has value because you're not buying something on the street where you don't know what it has in it. Is it tainted in some way? Does it have, any kind of dangerous chemicals in it? Go to a dispensary, you could get something that you can think is safe. But, how far do you go with this? And, have we gone too far? Time will tell.
What about other drugs? I mean, we're recording this in the middle part of May, and there have in recent weeks been at least two major DEA busts in Darien, again involving fentanyl as well too. Are we seeing fentanyl in showing up in your survey? Does Post 53 see any fentanyl overdoses?
As I said, our numbers are very low. So I don't know who they're finding DEA, if this is just a stopway on the I-95 corridor, north south. I don't know, but we're not really seeing it in our community as being a problem with respect to our calls locally. We've had calls for overdoses, and a couple of them have been actually up at the I-95 rest areas. They're not, we respond, but they're not necessarily residents. So, we seem to have been sort of, I think maybe, and maybe it's that high achievement quotient, that keeps people away from that in town. For the most part, I don't really know, but we're really we're doing somehow or other, we're doing a good job on that. And fentanyl really worries me, because there's all these illegal places where they're making pills, and people may think they're taking the Xanax and thinking they're taking one thing or another, Adderall or something, and it may just be fentanyl. And I'm an advocate for making fentanyl test strips more readily available to people, so that if they feel like they're going to take something and they're going to buy it somewhere from a friend, or not a friend, but just someplace on the street somewhere, that they can get test strips and test it on their own before they take it, because the last thing any of us want is to have somebody. They call them overdoses when they're fentanyl, but as far as I'm concerned, it's a poisoning, and it should be classified as such. I've been advocating that statewide, that a fentanyl overdose is really a fentanyl poisoning, because most people taking it, maybe not all, because some people want to get as close to the edge as possible, or so I'm told. And, but I think a lot of people are not doing it for that reason. And they're buying something they don't know. And as a result, they're poisoned. So don't buy from anybody you don't know, and get your drugs at a drugstore. And if you really want to smoke marijuana, go to a dispensary. You may pay a little bit more, but you know what you're getting.
And the police department in Post 53, I think, have the Narcanon overdose kits,
We
and
have
they're
our,
actually available over the counter now for
yep,
without a prescription,
yep.
right?
And I mentioned fentanyl test strips. You can buy them at Amazon. You don't need a prescription to buy a test kit. So if anybody wants to dabble, I don't advise it. I'm not advocating, but if you know someone who may be interested in dabbling, go to Amazon and buy your test strips. I don't know if they're available at the CVS pharmacy, but I do know they're available at Amazon.
Well, even if you think you're using cocaine or something like that, it could be something
Exactly.
much more, or heroin you're shooting up, etc.
Yep.
What a cheerful topic. David Knauf, our guest today on Inside Town Hall. Short timer that he is, he's leaving us at the end of June after his 15 years of service. You mentioned the C word a little earlier on. COVID happened. I can't believe it's already been 4 years now. But what did we as a town, you as a health professional, what did we learn from the COVID experience that may help us in the future?
Well, I would hope that on the global scale, not just here in the community, but on the global scale, it's so important that if something major like this comes along, that we have leadership that understands the issue and stays consistent with a message. We had a lot of back and forth and a lot of uncertainty that came from the top and went all the way through the entire system, that gave those of us who were here trying to work on a local level, it was very difficult with inconsistent messaging. And, from a statewide perspective, we also had a situation where our state health department that provides leadership to local health, we look to the state for guidance, the state looks to the federal government for guidance. And so, we don't want to be issuing statements here in Darien that's inconsistent with what's coming from New Canaan or Norwalk or Stanford. So that's why it's really important that we have consistent messaging from the top down. And in Connecticut, the governor fired the commissioner of health early in the stages of the pandemic. I think it was in the spring of 2020, and never replaced the commissioner with a full-time commissioner. It was a shared commissioner with another state department. So the role of public health in addressing a public health pandemic was really compromised, I think, politically throughout. So that left us really scrambling on a local level to try to get messaging out that was consistent. And of course, there was a lot of uncertainty. We didn't know what this thing COVID was at the beginning. And for the first year that people were getting sick from COVID, we had no vaccine. We had no treatment. So the only treatment was isolation and keeping people apart. What I learned on a local level here was that our community responded really well. The residents in town, I know that there were other communities where people were just infuriated and, protested and just made, the life of public health officials in particular really difficult. And, all forms of management worked very closely with our superintendent of schools, trying to make decisions on how to manage that. And, the school medical advisor and the nursing director. It was a day-to-day conversation and, with the selectmen in town to try to be consistent with the messaging. There was some impatience, with getting messages out. We worked with, myself, it was 24/7 for the first year and a half, basically, since it started like in first call I got from the state health department was in February of 2020, where we had a resident who was returning from China. If you recall, at first we were going to quarantine anybody coming from China, but it was going to go away. Well, it didn't. And, didn't matter if they were coming from China because people just started getting sick. And I'll never forget it. We were getting close to St. Patrick's Day in 2020, and everything was still open. And I'm just thinking, oh my God, if we have these parades and the bars are open, it's going to be a calamity. And I think it was like 3 days. I think it was maybe the 15th of March is when the governor announced that there was basically a shutdown and everything was closed. And we had to start figuring out how to manage food and getting food to people while people were supposed to be isolated, and which restaurants were going to stay open and how are they going to stay open and how are they going to protect their employees and, and transfer the food to people who are coming to pick them up, and how do you pick them up? And, the micromanagement details that we had to go through during that period of time were incredible. There was no personal protective equipment available. There were no facial masks. We had a group of residents actually in town who got together and started making masks for us and gave them to us to kind of circulate to our healthcare providers in town, because even they couldn't get protective equipment at first. So it was quite a task, and we interacted with sports groups and leagues, and one kid on a team tested positive, or this is even the testing is a whole nother thing, but ended up with symptoms. And do we tell the whole team they have to stay home? And how do you stay home, and how do you isolate on a home basis? And boy, when I think about it, the level of detail that we were involved with is incredible. We're regulating establishments, retail stores, interacting with people we never interacted with before. And
Yeah, you're reminding me of all kinds of horrible things that I'm trying to block out of my memory at this point. But we finally did get vaccines, and in some parts of the country they were not, shall we say, embraced. Do you have any stats on how many people in Darien actually got vaccinated at least once?
Yeah, we were statewide leaders. Absolutely. I was watching that closely, and I can say, our vaccination numbers, even to this day, even with the booster shots, we're still leaders in the state. And I can say that back when we first started, the first round, we were, if not number one, we were really up there number one and number two. And we did not have pushback. Every once in a while somebody would have a comment, but we never had some of the difficulties that other communities had with respect to residents. And in fact, the residents of Darien made it possible for Darien to be number one because they volunteered so heavily for the clinics that we had. I think I mentioned our staff, but our staff at that time, there was myself, one other full-time person, and we have a part-time nurse and a part-time emergency preparedness coordinator. That's our staff, and that was our staff. And yet we stood up 65 clinics and vaccinated and administered over 9,000 doses of vaccine during the period of time that we were offering vaccine. We had never done anything like that before, nothing like that to that scale. Certainly we did seasonal clinics, but the most we ever administered in seasonal clinics on a day was maybe 50 or 60. And we had one day where we did over 700 shots in one day. We're working with the schools.
And in retrospect, I mean, now that we can look back over 3 years of vaccine use and revisions of the vaccine and boosters, full disclosure, I've had 5 vaccination shots. I got them all early and keep getting them as well too, and I've had no ill effects. But is there any scientific data that that shows that the skeptics might have been right? Well, there might be a few individuals that suffered from getting the vaccine, but given the millions of Americans that received the vaccine, is there any evidence that it was dangerous to large portions of the population?
Well, there's nothing that I've seen. There's nothing that I've seen that would indicate that to be the case, but you can find anything you want to find on the internet that says anything you want it to say. So sure, there's data sources on the internet that indicate, there's all these side effects. And of course we said we weren't going to talk about presidents, but we do have a candidate who is an anti-vaxxer. And, but I have not seen any data, and I look for it, because I don't want to administer something or advocate for something that I have any particular reservations for, and I wouldn't do that. And if I thought there was a problem on a community basis, even before I was a short termer, I wouldn't promote something that I didn't believe in.
Did you get your shots?
I have booster shots as well. Yes.
Well, maybe
I'm
we
in
should
one of
just,
those high risk, age groups. So,
yeah,
I'm going to do it.
yeah.
Absolutely.
So why did there, I mean, aside from the volunteers that turned out to help do the vaccinations, the coordination of your office with the first selectman and the emergency preparedness people, and why did Darien have such a high adoption rate of vaccines? Is it because we're smarter? We followed the science? I mean, you weren't pushing it on people. It was completely voluntary. But why did Darien do so well compared to other communities?
I think you answered your own question. Honestly, I believe that, people in Darien are aware, they pay attention, and they're thoughtful. I've found that to be my experience here, whatever the subject, in communicating with residents. It's been a real pleasure because people listen, and they're, sure, you'll have the reactions, and maybe not all the time they're liking what they hear from us. We're a regulatory, agency, obviously. And people don't always like what they hear, but if they get a decent explanation, it works. And I think that that makes a big difference. And yes, I do think, again, you look at the demographic of the community. We're a high achieving community. We're highly educated, and people know where to go to get information. And I think that's the answer.
And maybe Fox News is not the best place to get information.
Well,
I said that, you didn't. No, but I mean, you're making a good point, which is people followed the science, they listened to the experts, they made choices for themselves and their families,
yep.
and that's why Darien did so well in getting vaccinations, right?
Absolutely. And our illness levels were lower than the state. So, looking at fatality rates here, we were very low. I think, sad to say, I think there were a total of 14 fatalities associated with COVID. And on a percentage basis for this community, that's really low. And, that may not have been the cause of death, but people did have COVID when they passed. And it's sad, to lose anybody and to have anybody have that as being a potential reason for it. But the reality is, and even further, after vaccines were available, there wasn't a single COVID related fatality after the vaccines were available. And most of those early on were people who, had other health issues to begin with, because that was always one of the high risk areas, was the elderly and those who had underlying health concerns. But our numbers for total fatalities were way lower on a percentage basis than, most other communities, and same with illness numbers. We're still
And
getting positive cases, I will say,
right.
'cause I'm still tracking that. But, we do not obviously know what, the home testing results are. We never did, but but it's still out there.
Did you get COVID?
I did.
And how was it?
Well, for me, I was lucky. I got sick for, a couple of days, and it was it was actually over this past winter. So I never got it the first time through, before the vaccine was available.
Hmm.
I got it after. And of course, people would say, well, you got vaccinated. Why did you get it? And it was like the point of the vaccine wasn't necessarily to keep you from getting it, but it was also to make sure that if you did get it, you got a mild version and you wouldn't end up in the hospital. So, I will credit the vaccine to having it be that my positive case was a relatively mild one, the two times.
Mine as well too. Fortunately, I got it twice, and got Paxlovid the first time,
Me too.
and took the pills,
It works.
kind of got over it.
It's amazing.
Second,
And all that stuff, you
yeah.
know, the Paxlovid and the vaccine was developed within 1 year of the appearance of a novel pandemic. That's a tremendous achievement on a worldwide basis. And, you know, for it to be questioned on a political basis, I'm astounded by that.
Well, we started promising we weren't going to talk about politics when we began this interview, but we'll just stop there. How's that? David Knauf, who is retiring as the director of the Darien Health Department at the end of June after a 15-year career here and a total of 55 years in the healthcare field. First of all, thank you very much for your service to the town. We wish you nothing but happiness and success with your family in your golden years, as we say. And we hope you don't make yourself a stranger around here. You know the way to Darien pretty well by now.
Yep. Yep, I do. And it's been a great experience for me. Pleasure working with you, Jim. And I've enjoyed these conversations, both on camera and off. And I've been very fortunate, and it's been, as I said, a tremendous experience here. It's a great community.
Well, best of luck to you, David. Thank you again very much.
Thank you, Jim.
And thank you, our faithful viewers, for watching yet another edition, albeit his last interview here on TV 79.